The Ghana Nutrition Improvement Project is a joint collaboration between Ajinomoto, the University of Ghana, and the International Nutrition Foundation based in the United States.
It started when the Ajinomoto group, during their centenary celebration, decided, as part of their corporate social responsibility, to support the production of nutritious foods for infants and growing children between the ages of 6 months and 24 months in any of the developing countries.
The project focused on identifying solutions to the issue of malnutrition in children aged 6 to 24 months, amongst whom stunting prevalence is high due to insufficient intake of essential nutrients such as protein and micronutrients.
The 3 districts were trained in SBCC, Social Behavioral Change Communication, and Infant and Young Child Feeding practices. And so nurses were oriented on how to do nutrition counseling, how to capture data on infant and young child feeding, and how to report.
The GNIP partners developed a nutritional supplement product, KOKO Plus, to improve the nutritional profile of cocoa, a traditional corn-based porridge used by Ghanaian mothers as a main infant complement food to breastfeeding. At the core of the GNIP is a public-private partnership between Ajinomoto Foundation and the Ghana Health Service. 2 years into their collaboration, the GHS and TAF have covered 57 districts in 7 regions. As of March 2021, around 86,000 mothers have achieved behavioral change in the use of KOKO Plus. The partners aim to expand 178 districts and to reach 429,000 mothers by the year 2025.
And we have benefited a lot from this project. They provided us with IENC materials, counseling cards, and big poster where we have the various things we talk about in terms of age, frequency, amount, variety, texture, hygiene practices, responsive feeding, the AFAD VRH that we used for our nutrition counseling, pasted in our outreach points or service delivery points, where if a mother comes in for services, the staff can look on that and do counseling.
In 2018, KOKO Plus obtained approval from the United Nations World Food Programme to improve KOKO Plus in food program in Ghana.
And as part of the collaboration, they have to identify a food manufacturer in Ghana that would manufacture the sample products that were used in the research. And so they settled on Yeden Agro-Foods Processing Company.
This increased the confidence of the GHS and TAF to initiate that collaboration to deliver nutrition education and promote the effective use of KOKO Plus in Ghana.
The KOKO Plus na yema enkra from 6 months to 2 years. So enkra no ontimi ndidi ye. Anase koko no ya ye kan some of more raw. Into unya KOKO Plus na kana de guma. Eboa ma akra na nyini ye.
Ye good. Ultimi de fra koko, ultimi de fra nkwan aduane bia, ultimi de KOKO Plus fra. Emo akra no a obedi osori anopa ultimi say yes, amode egonimu.
I would like to encourage fellow colleagues or staff who are on this project to continue to work hard. A lot has been spent in training or building your capacity. Therefore, you would have to ensure that you give your utmost best. Ensure that you counsel mothers that are due for counseling, or mothers that have children who are at risk of malnutrition. Ensure that the tools that you've been given are being used appropriately.
And so research has shown that a lot of weaning children either become stunted or reduce in their growing weight. And so we believe that this effort and this vision by the Ajinomoto Foundation has been a very beneficial one to the Ghanaian population, especially young people in Ghana, and we want to commend the foundation for this effort.
I believe that the Ghana-Japan PPP story will create a successful model that can be scaled up in the rest of Africa.
Let's create an environment in which children can grow up healthily.